The greater trochanter is a large, prominent bony prominence located at the upper end of the femur, also known as the thigh bone. It serves as a crucial attachment point for several muscles that play essential roles in hip movement and stability. The patella, commonly known as the kneecap, is a sesamoid bone embedded within the quadriceps tendon, the large tendon that connects the four muscles of the quadriceps femoris muscle group to the tibia, the shin bone. It is located at the anterior aspect of the knee joint, protecting the patellofemoral joint, the articulation between the patella and the femur, from external forces. The tibial tuberosity is a prominent bony bump located on the anterior aspect of the proximal tibia, the upper part of the shin bone. It serves as the attachment point for the patellar ligament, the thick band of tissue that connects the patella to the tibia. The lateral malleolus is a bony prominence located on the outer side of the ankle joint. It is the distal end of the fibula, one of the two long bones of the lower leg. The lateral malleolus is positioned just below the medial malleolus, the bony prominence on the inner side of the ankle joint. The medial malleolus is a bony prominence located on the inner side of the ankle joint. It is formed by the distal end of the tibia, the larger of the two bones in the lower leg. The medial malleolus can be felt as a bump on the inner ankle bone. The calcaneus, also known as the heel bone, is the largest bone in the foot. It is located at the back of the foot, just below the ankle joint. So next, I'm going to demonstrate each movement of the synovial joints. Angle between forearm and arm decrease, as Ulna moves to work your humerus bone. Angle at the humerus of arm and scapula bone decreases, as arms move anteriorly. The movement of a structure away from its midline reference point. Adduction occurs as the structure is added back towards the midline reference. Finger abduction, away from hand midline. Thumb abduction. Dot is an anterior motion. Adduction ADD adds the thumb to the hand. Waist abduction moves away from midline. Medial rotation occurs as the anterior surface of the head returns towards the anatomical position. The vertebral column can rotate laterally to the left or right. Circumduction. Think a circular or conical movement of a structure. With arm flexion, then arm abduction. Next is arm extension, follows by arm adduction. When you combine those movements into a smooth motion, you can see how it forms a cone or circle. Pronate. A movement of the palm of the hand and interior or upward. Supination. Movement of the palm from a posterior position to an anterior position, the anatomical position. Supination is the opposite of pronation. During supination, the radius on ulna are parallel. Inversion. Movement that results in the medial turning of the sole of the foot. Eversion. A movement that results in the lateral turning of the sole of the foot, the opposite of inversion. Dorsiflexion. A movement of the ankle joint in a dorsal direction, standing on one's heels. Plantar flexion. A movement of the ankle joint in which the foot is flexed downward, standing on one's toes, or pointing the toes.